million rand COVID-19 compensation of employees' budget allocated to the Gauteng Health Department for the 2022-2023 financial year has sparked discontent among admin and support staff hired on the COVID-19 contract. The staffers held a picket outside the Dr. George Mukhari Academic Hospital. This after they were informed by their managers that the budget will not be enough to retain all of them. SABC News senior reporter Ofentse Setimo has more for us.
The prospect of losing jobs has prompted the support staff at Dr. George Mukhari Academic Hospital to launch a picket on the entrance. This after the Department of Health in the province announced that some of them will actually lose their job as their budget has been slashed from what was requested, which was 1.1 billion, to the 600 that they were allocated. And joining me now is Thulani Thole to elaborate a bit further on how this is going to affect them. Thulani, thank you so much for your time. Can you just tell us which staffers who were recruited during COVID-19 are going to be affected by the prospect of losing jobs?
Thank you very much. Those who will be affected are the clinical and non-clinical employees. The doctors, nurses, clerks, cleaners, and porters are affected. And even but the re-advertisement or apply again, meaning they want to reduce staff, meaning job miracle cleaning because of Dr. George Mukhari Academic Hospital. It's the second largest hospital in South Africa, which accommodates all of the provinces. Meaning what cleaning a big shortage. What it like a big shortage. The waiting time is because of a shortage of staff, the nurse arena and the doctor arena.
And I understand that you guys are also concerned about the issue of corruption and nepotism that has plagued the institution over time. I understand some senior officials have actually been suspended for hiring some of their family members. Can you elaborate on that?
Yes, on that one, I'm the one who was in a more contracting or internship for 4 years, but I wasn't ever being shortlisted for interviews. So I'm not sure about that what's happening, but on 4 years contracting in more EPWP. I was keeping on applying and but I wasn't shortlisted. Only I was shortlisted COVID-19, which last year, 1st of April.
Yes. What would you want to tell the provincial health department about the challenges that you guys are facing?
Our challenges, most of our families, they depend on us. Some have children, some they have children, some they have, but all the families but depend on more financial. Meaning food, abasato balidijo, kamalapem batlo sokola ba go shabana ba dikolong. And ba bang ba agamala pa bona gore ba kgonwa le dintlo. Since well mo South Africa go na le challenge ya dintlo tsa rena di are kgono khumana di RDP houses. So we are independent, re depend more tšhelete re khumana gore re kgone go ba le dintlo re kgone le go iphidisa bjale ka South Africa. So tlhotlo e kgolo ya rena go gore e santse ba re contract another year ba re contract re permanent, and even but really the internal posts are permanent, but permanent re na re leng ka mogare, so that re kgone go phela le rena re diphidiša gabotse. And e lengwe ya tšhelete e re humana mo ke gore e re thusa educationally to further our studies as the rights of South Africans gore re kgone go tswela pele ka bophelo gore without education nothing else we can do.
Thank you very much. Well, as you heard, that's Thulani Thole actually saying that, you know, they demand that the Department of Health in the province must insource them as they were recruited during the time when they were desperately needed during the time of the COVID pandemic, and they feel that they deserve a spot or at least an extension of their contract, as they feel that, you know, they were available when they were needed the most, and now they need employment the most, and the department should respond positively.